So moved.
All right, it's motion by Dr. Key and second by Lee. All those in favor of the minutes being approved, signify by saying aye. And those opposed by nay. Ayes have it. All right. Next on our agenda, we have Ms. Walker.
Good afternoon, everyone. Thank you all for allowing for me to present to you this afternoon an update on our first quarter human resources dashboard. As I report out, as we look at the dashboard, our focus is for the annual incentive plan is on voluntary turnover. So when you do review the dashboard for the first quarter, we did in the first quarter at 14.39 with a close from FY18 of 13.06. So for us, we did score a little bit higher than what we did for the end of FY18, but of course, there are several projects and work around focusing on the total involuntary turnover for this year. Of course, Bill will be coming up to focus and discuss the AIP metrics, but that is an area of focus for us. So wanted to provide a report out on the turnover. Just wanted to ask, are there any questions relating to the first quarter report out?
No, there are no questions
Okay.
on the report.
Okay.
All right.
Okay. Thank you very much.
All right. I think next I have Bill. You want to come up and do the annual and the long-term?
Okay, any questions? Doesn't hurt to try. Doesn't hurt to try. Okay, so my purpose today is to review with you the metrics and the performance first quarter for the annual incentive plan and the long-term incentive plan. And just to jump right in there, we have quality. As you might recall from earlier discussions, the patient safety index of PSI 90 consists of 10 indicators. It's a composite measure. And one is right where we really want to be all of the time. Anything above one is not considered positive. Anything below one is even better than one. So one's kind of normalized given the patients that we care for. So for the first quarter, we have some opportunities. As you see, we're not exactly where we want to be. We've got, and each one of these indicators too are weighted differently. Just know that, depending on the severity of some of these indicators that are being monitored and measured. So we have three that really are above where we want them to be at the end of the first quarter. One is perioperative hemorrhage and hematoma. That's a 7% weight. The other is post-op respiratory failure. That's a 30.5% weight. And the last one that we're a little above target is the peri-op PE and DVT, pulmonary embolism and deep vein thrombosis indicator. So it doesn't take many patients to really skew this rate, if you will, because there's not a lot of, the denominator's not large. But we do have some work and we do have some plans that we have developed, and we're now in the process of aligning those service lines within a claim to the overall opportunity and the plan that we have as an organization going forward. So we will bring back better news for you at the next time we bring this forward.
Bill, how did those particular areas get weighted so heavily?
That is
based on a
part of the
reaction to what?
Black box formula, and I don't know. And Tricia, do you know?
Tricia's there.
For that? It's a great question, and there is a rationale for why the weights are different.
Yes. Good afternoon. So the weights for the PSI 90 metric components are assigned by the severity of harm for which they cause to patients, as well as the cost implications, and then the prevalence of these particular events across the country. So the weights shift from year to year based upon the activity that is being observed in patient care.
So they're the same weights for all hospitals, tracking the same metrics?
Correct.
It's a national measure.
We don't set those
Okay.
weights. Those weights are set by standards that are not any of our control or any other hospital's control.
Okay.
Okay, thank you. Next metric that we're measuring is service, HCAHPS and patient experience in the outpatient realm. So HCAHPS, we changed the definition a little bit in terms of how we're going to measure that this year. And there is an overall national rate of improvement for every dimension within the HCAHPS survey. There are 10 dimensions. And this, again, is a national comparison. So based on all of the inputs from the organizations through HCAHPS measurement, there is a rate of improvement that everyone is experiencing. Some dimensions improve faster than others. Our goal this year is for 3, 5, and 8 dimensions to improve equal to or greater than the national rate of improvement. Instead of just looking at percentile ranking or mean score, we want to focus on the dimensions that are improving. So for the first quarter, for HCAHPS, 3 of those dimensions either equaled or they were greater than the national rate of improvement for those same dimensions. Patient experience, we don't have the same ability to compare ourselves to others in this respect. So we have carved out primary care, specialty care, and women's health, have 10 questions that we're asking all of our patients within those clinics, and we have established a 0.3 as a rate of improvement for each one of those questions. So much like HCAHPS, where there's a national rate of improvement, and some of those national rates of improvement are 0.1, 0.2, we have said 0.3 is going to be our rate of improvement for every question in the outpatient realm. So you can see we had the same performance targets, threshold target stretch, 3, 5, 8 as the HCAHPS, and through the first quarter, 7 of those questions in primary, specialty, and women's health have improved by 0.3 or greater over last year. So that's all positive. People. Pia just discussed voluntary turnover with you. There are 11 more individuals, employees who have resigned this first quarter than last year at the same time. And that makes up the difference between what we experienced last year, which I think was around 12%, and where we are this year at 14.39. We know the areas that we've experienced a higher voluntary turnover, and we're working with those areas to develop action plans, but it's all about, not all about, but a great part of that is recruitment, is finding the right people for the right place and the right time and the right job. The other 2 metrics that we're tracking is employee engagement and physician engagement. There are action plans around each one of those performance indicators, and there's only a one-time opportunity every year to actually score your performance, and that's September of 2019. So you can see what we did last year, 4.37, 3.89, and what our performance expectations are for the fiscal year 18. Stewardship, we've established 2 metrics. One that Sharon spoke to you about when these were approved, modified cost per adjusted admission. It is net of certain expenses that we cannot control or influence directly. That is what we want to be in terms of fair to our frontline and our managers. You can see there's 2 there. One metric is for VPs and above, and the other is for directors and below. So modified cost per admission is something that we've challenged our leadership team, directors and below, to achieve. And that's net of those expenses we can't control or influence. We know what that number is year to date, but there's a lot of things that are coming online in the future, like next month or month after next, things that we budgeted for and planned for, that's going to skew this number a bit. We experienced that same thing last year. So if you put that number out, which is favorable right now, it's around the target area. You put that number out too early, there might be a tendency to kind of think we're doing really well when we might not be. So we want to focus on that and keep it something that we bring periodically, not every month, but periodically as we incur some of the expenses that we anticipate or that we don't anticipate. The other indicator is something that we challenged the leadership team with last year, which was the operating margin, net operating margin. And based on those of you who were in the finance meeting this morning, the first quarter has done quite well. We have done quite well as an organization. And that fiscal year to date through December is 1.59% net operating margin, which exceeds all of the other performance outcome targets. And that's the annual incentive plan metrics, and I'll be happy to answer any questions that anyone might have about that.
Yes.
Bill, on the service metric?
Yes, sir.
When talking about the 10 questions that we ask, is that just simply based on the care that the providers give, or is it their entire experience from time to get an appointment through seeing the provider and then paying and checking out?
On the outpatient?
Yes.
The 10 questions?
Yeah.
I have someone behind me that will be happy to answer those questions. That's her. Sure.
Hi. So it actually does encompass the entire visit.
Okay.
So there's a large bulk of the questions that revolve specifically around the provider, but then there are also questions that are from the receptionist piece, which we're actually alternating from ease of getting an appointment. Did you make a phone call to make the appointment, and what was the ease of that, as well as when they checked in?
Okay.
So it goes through the
Yeah, I just wanted to
gamut.
make sure if it
Yeah.
covered the whole spectrum of care, not just the provider piece.
Yes, and I'm actually bringing all of the questions and dimensions with me to quality.
Oh, okay.
So we'll review all
Okay.
of those together as well. So, but thank you for the question.
Any other questions? Okay, all right.
Okay. Moving to the long-term incentive plan, you've seen this before. These are our two metrics that we're tracking. One is leapfrog, which we think is extremely important. It consists of 30-some-odd indicators. A significant component of leapfrog is PSI 90, which I just reviewed with you. It's less than 20%, but still, it is something that we truly need to focus on if we're going to maintain our overall letter grade of B and improve upon that. So the other metric is cost per adjusted patient admission, which we just reviewed in the annual incentive plan, except this is what leadership is responsible for in the long term, and the directors and below are responsible for that in the annual plan. So same answer there. We do have a number, but it's really too early to post that and have any degree of confidence about its ability to maintain that level. Be happy to, and the leapfrog score, we'll have one in April, and then one again in November, again for the fiscal year ending September 30th. So little soon for that yet.
Okay.
Bill, help me remember the cost per adjusted patient admission.
The definition?
Bill, between target and stretch, when you go from 13.2 to 13.214.
13,291 to 13,242 to 13,214. What the,
No, the question should be, you were at 1277, 12,000. We went up.
We went up.
right.
Yeah.
I'm out of practice. So the difference between our threshold represents budgeted expenses and budgeted admissions. The target, I believe, is a $3 million savings, and the stretch is a $5 million savings from budget. And we did go up from baseline to budget threshold because of the natural inflationary impacts that we have. You know, salaries go up 3.5% every year.
And pharmaceuticals, I knew I had.
And pharmacy is an enormous expense increase.
Thanks.
You bet.
Any other questions? Okay. Thank you.
Okay, we'll bring this back next time we meet.
Okay.
Thank you.
All right, thank you. You know, what I need to do now is for us to go into executive session, because I have some information that I need to share with the board. So I don't have,
Would you mind if I went into, when we did close, I did my portion of close first, and
Yeah.
then everybody else come back in? What we're gonna do, this closed session is gonna cause everybody except Mr. Whitman to leave the room, and that will literally take 5 minutes. And then we'll ask those of you, Pia and Steve, to come back in regarding the finance part of it, if y'all don't mind. I'll see you.
yeah, you need to state, you gotta find something, yeah, I'm sorry, because we do have
Yeah.
Roger, who wasn't here.